So clinically, I think the heart of what we do is synthesize the different aspects of the experience of the patients we see and then work out the best way forward. And that means considering what we call the biological, or what you could best think of as an illness, along with the psychological. In other words, what is it about the person, what's been happening in their lives, and their response that is unique, and the social aspects, the effect of family, friends, and the wider social environment. Then we use that to work out the best way to help. And that, to me, really is the essence of the art of medicine. We often think of medicine in technical terms as making a diagnosis, investigating, coming up with an intervention. In reality, much of medicine is about working with people with chronic disease, and that involves understanding the whole person, as I've described. And I think psychiatry is the most sophisticated manifestation of that art, if you like. And the other main part of what we do is we work in teams, in multidisciplinary teams. And consultants in particular have a very important leadership role in those teams. My own observations over the years has been that when the consultant, the team manager, other lead professionals work well together, that's when you get the best quality of care. Learning the necessary expertise to do that is both interesting and challenging, but I believe it gives us life skills that extend beyond the realm of medicine. So I think the other great value of general adult psychiatry is the diversity, the variety, and the complexity of the nature of the work we do and the settings in which we do it. I've worked in many different settings over my career, from inpatients to community, and currently much of my work involves seeing people at home. I particularly enjoyed working in the London borough of Hounslow, where one visit you could be in a swanky flat overlooking the river in Chiswick, and then the next visit you'd be in the far more deprived area of Feltham in a council estate. And I think that gives us a very unique insight into society and the variety of people's experiences within our society. And I think that's a very valuable insight to have in life. Well, really, I think what's unique about is the general. We have much debate about this, but actually we deal with all aspects of patient experience. And because the key to what we do is understanding the psychological and the social as well as the biological, the breadth of experience that we gain in general psychiatry is really quite critical to our work. And it's something that is less, you get less of that if you're in a more specialized area. Is that you see things from a whole variety of different perspectives and domains, which you then apply to what you do with each individual person. The field is also a developing one. Neuroscience is constantly moving forward, and therefore so is our framework of understanding of the overall picture of psychiatry. There are plenty of opportunities within general adult psychiatry to undertake research. And in fact, one's career can develop in interesting ways. I now spend much of my time working on the application of digital tools to enhance our practice. I find that really very interesting, but it's something I could never have imagined doing when I started out in the field. Well, I'm nearer the end of my career than the beginning, but I think that allows me to understand the importance of thinking about the whole lifetime of one's work experience when choosing a specialty. I hope I've illustrated that working in general adult psychiatry is forever interesting and stimulating. And that's not necessarily true of some of the more technical aspects of medicine, or indeed some of the more specialized parts. General adult psychiatry is fascinating and diverse. It involves working with and interacting with many different professional colleagues. We establish quite deep therapeutic relationships with our patients, and we learn a set of life skills and perspectives that are valuable within, but also well beyond the world of medicine. It hasn't all been plain sailing, but over the years, I think I can say general adult psychiatry has served me very well, and I would thoroughly recommend it as a career to those starting out in medicine.